We report often on Vermont's opioid crisis and its impact on Vermont communities. It's measured in numbers like overdoses and deaths, but it's not easily measured in terms of treatment and recovery.
Tonight, we begin a three-part investigation into what drug treatment looks like in Vermont and how well it's working. In part one, Laura Ullman explores what is often the first step to recovery, a stay in rehab.
I'm from St. Albans, Vermont, and I grew up in a pretty healthy home.
Josh was a beautiful little boy, very high-spirited, a lot of fun. He was very popular in school.
Josh Lash's vision of his life changed in an instant when he started using drugs at 18. His mom, Celinda Santor, found out years later. The night her sister died, Josh showed up suffering from withdrawal.
I turned and looked at him, and I made him stay at my sister's house with me for 2 weeks to try to detox him on my own, and very unsuccessful.
Moving into recovery for me at first was people kind of pushing me to do it, and that kind of caused me to not really be ready to go in yet.
Self-admission is what experts agree is the best way to enter recovery.
So the process of getting in here would require the individual in need to give us a call.
Chad Vijay heads a nonprofit that runs 2 residential treatment programs. These programs are often the first steps toward recovery.
That call can be supplemented with a referral from a hospital, a recovery center, a loved one, but really we want to hear from the individual.
Josh Lash relapsed 3 times after attending a separate residential treatment program in the state Valley Vista in Bradford. In October, xylazine sent Lash to a breaking point.
He almost lost his foot, and I think that scared him.
When he got discharged, his mother drove him that night to Valley Vista.
We just talked the whole time, and I'm like, I just want my boy back, Josh. I want you back. And he promised me he would, and he's coming through with it. So I'm very thankful for that.
The first few days at a residential treatment center are detox. After that, meetings all day.
It's really what people in early recovery need, is to keep their mind focused on, recovery.
Most people who go to Valley Vista or other residential treatment programs use a state insurance plan, which covers a base rate per patient. They can stay as long as they want, but state insurance barely covers a 2-week stay, and the provider picks up the rest of the tab.
The cost of treatment has more than doubled.
Valley Vista's Rick Stefano says that's due to the high cost of nurses who are contracted through an agency due to the lack of medical professionals in state.
I think we've done a poor job as a system to incentivize working in this field. It's very difficult when school is expensive and the pay in this field isn't competitive with other healthcare fields.
Waves of retirement and burnout during COVID and the closure of a sober home in 2021 have also hit the industry hard.
I believe we were somewhere in the realm of 500 to 600 licensed alcohol and drug counselors pre-COVID, if I'm not mistaken. I believe we're down to about 263.
The staffing problems have decreased bed availability in recovery homes across Vermont. And with the rising cost of care, providers can't foot the bill for people starting their recovery journey to stay longer.
I wanted him to stay for 4 weeks, 6 weeks, 8 weeks, anything but 2 weeks. 2 weeks is not enough time for someone to get the proper help. It's not.
Santor is grateful her son was able to move into a recovery residence in Maine because of the lack of openings in Vermont. Despite the distance, his mom is just happy he's alive.
I just don't want people to give up on him. You can't give up on him. People will tell you to, but don't listen to them. Don't give up on him. I'm so glad I didn't give up on mine. I'm so glad, because it was worth the wait.
Josh Lash still lives at that recovery residence today. He was able to move in after stopping his medication-assisted treatment, which is what doctors say is the best option to abstain from opiate use. In part 2 of my special report, we'll break down what that treatment looks like and why it may not be the silver bullet to the opioid epidemic. In the studio, Laura Ullman, Channel 3 News.
Suboxone and methadone have proven to be life-saving for people in recovery. But if it's so accessible and successful, why do more and more people continue to die from overdoses?
Laura Ullman continues her investigation into drug treatment and recovery and joins us live now in the studio. Laura?
Darren, in part one of our special report, we told you how residential treatment programs can be costly but critical for care. Now, in our part two, I asked experts and users how medication for opiate use disorder factors into the recovery process.
Music and art is so extremely healing because of what it does scientifically for the brain, and also, you know, being in recovery, it's a very spiritual journey, so what it does for the spirit.
Melinda White says she was born with an addictive personality. First it was candy, then catching frogs.
If I can catch 20, then 50 frogs are better. If I have one candy bar, 25. So I was always a more. If I liked it, I wanted more, no matter what it was.
From a loving family in St. Albans, she also grew up curious, wanting to understand and experience everything. She was a teen when she tried marijuana, then alcohol.
But I always said to myself, I will never be like those junkies out there that use cocaine and shoot up heroin. Like, I'll never be like that. And I was a horrible, judgmental person in that way. Because at the time, I thought, those are the losers. Little did I know that I would become that loser.
It was a failed suicide attempt that first moved White toward abstinence. Her youth pastor and spirituality guided her out of despair. She now helps others through medical and clinical recovery.
At the end of the day, I know what worked for me. I also know that doesn't mean it's going to work for everybody else.
Kelly Peck, a researcher who studies adults with untreated opiate use disorder at the University of Vermont, agrees.
You have to take a person-centered approach to treatment, in that, like, not everybody is the same or has the same goals.
Peck is currently studying medications for opiate use disorder, or MOUD. The medications are part of what some know as the hub-and-spoke model. Vermont was the first state in the nation to implement the hub-and-spoke model. The hub refers to the place where people can go for higher level of care at the beginning of their use of MOUD. It's the only place people can access methadone, which activates opioid receptors similarly to narcotics. Spokes are primary care offices or outpatient addiction services in one's community, places White has worked.
A spoke is when a person is allegedly a little bit more stable in their recovery, that they can get a prescription for sometimes a week at a time, 2 weeks at a time, sometimes maybe a month at a time.
Medicine for opiate use disorder attempts to stop cravings and/or withdrawal symptoms.
If your goal is to abstain from non-prescribed opioid use, these medications are going to give you the best shot at doing that.
Studies shared by the National Institute on Drug Abuse show that those who use methadone in their recovery are 4.4 times more likely to stay in treatment than those who don't. Another study shows that the treatment failure rate of those given Suboxone was 25% compared to 100% of those who received a placebo. While the data shows the medication works, and doctors almost always recommend it, it doesn't always produce its desired results. We introduced you to Josh Lash, who currently lives in a recovery residence. He can't take medication while staying there and has had a tough time coming off of methadone and Suboxone.
Still withdrawing from it. I'm still getting bad mood swings. My body hurts.
He says it inhibits his ability to feel emotions and to taste food.
People need it. Some people I don't think should ever take it.
Despite his challenges, medication is typically the top option for people in recovery. And with access to this potentially life-saving treatment being easier than ever, why are more people than ever dying from overdoses?
One of the challenges that we face now is how do we make treatment even more accessible? How do we, for the folks who, how do we get people engaged?
Things were looking up toward the end of the last decade. Overdoses were down, more people were in treatment. So what changed?
Pre-COVID, there was really a real build in collaboration and talking together. And then as we all sort of had the retreat to our homes for COVID, that disrupted things a bit. And then with the introduction of fentanyl and xylazine, as that got worse, it's sort of like a double-edged.
On top of COVID and a more toxic drug supply, White says she has also seen a shift in the type of care for people in recovery, a focus on compassion and forgiveness instead of structure and accountability.
For myself, I love science in a sense that sometimes I just need to see black and white, tell me what's going to work, let's do this. On the flip side, the gray area tends to be sometimes where the most healing can happen.
As many of the experts have said, there is no one-size-fits-all for people in recovery. But as the drugs become more dangerous, it's become harder to get a grasp on the problem. In the final part of my special report, we explore the lack of recovery residences and why some say if we only had more beds, it would address a major gap in the recovery process.
Long-term housing is key to helping people in recovery. That's according to experts in the field. But in Vermont, there's not enough.
But why? And do residential treatment beds really work? Our Laura Ullman has the final chapter in her 3-part investigation.
There we go. Gotcha.
Ricky Lesko Navarro started using drugs and alcohol when he was 13 years old. His parents suffered from substance use disorder. He says in the community he grew up in, drinking, smoking, and cocaine were just kind of the things to do.
In California, you know, it's like a fast lifestyle.
Hitting rock bottom, a rude or spiritual awakening, Ricky says that's what it takes for some people with substance use disorder to finally want to get sober.
It really just has to come from yourself. For me, you know, no amount of, therapy or, no amount of love, no money, nothing, could get me sober.
It was 6 years ago Ricky decided to quit drugs and alcohol. Since then, he's tried abstinence 14 times. This time, he thinks it might be different.
It's the longest I've had for a while, for a couple years.
Would you pick up a girl on the way?
How you doing? I did.
Ricky's undergone a lot of change in the past few years. Relocating to Vermont, clinical treatment, and moving in here, a recovery residence in Rutland for men. 1 house out of 7, run by the Vermont Foundation of Recovery.
If that's shared, they would just put it there.
Andrew Gagne is their director of operations.
So this is our double.
Gagne was incarcerated for 3 years and toward the end of his sentence discovered what he wanted to do with the rest of his life.
There's a lot of people that were incarcerated. A lot of their crimes were connected to alcohol, drug addiction, and when they would get out, they would go right back to the place that they were when they got arrested, so that didn't really make a lot of sense to me. So I wanted to create a place for people that could go that was safe.
The nonprofit's mission is to create a statewide network of sober living homes to help people suffering from substance use to transition from active use to recovery to independent living.
And if I had my own place, this early on, I don't think I'd be able to hold myself accountable for it. I might be able to, but I don't want to take the chance. Make sure you're on your chores, they make sure you take your medications when it's supposed to be, and they make sure you're going to your therapy.
Everyone I spoke to at the house seemed to like the idea of structure and responsibility. Joseph Mossy, Lesko Navarro's roommate, echoed his sentiments.
I don't have to be here. I choose to be here.
Staying here has encouraged his longest continued sobriety. He said everyone's life is centered on recovery, and he likes that.
It's a family atmosphere. It's nice. It's really worked for me this time.
So this guy gets this in the closet?
Residents here pay membership dues, a sort of rent, $600 a month.
The chore chart, this is everybody's number.
Chore chart.
They ask those in the house to either work or volunteer, attend weekly meetings, take drug tests. Staff distributes medicine for opiate use disorder. Residents make goals and set out to achieve them.
We have our set policies, but we also understand that there are individual cases that do come up, right? So we do try to follow our policies, but we also want to lead with compassion.
Recovery residences are peer support, not clinical, so they aren't covered by state-sponsored or private insurances. Gagne says the majority, if not every single person that goes into treatment is on state insurance. Those who wish to enter recovery residences pay out of pocket. That may not be for much longer.
The state has done a nice job working to negotiate with Medicaid a waiver that will go in effect in 2025.
Not only do financial barriers pose an issue to long-term recovery, but availability and locality pose issues as well.
We usually always have a waiting list for all our locations.
We don't have good geographic distribution, so that can be an issue for some folks. Some folks maybe need to stay closer to their community.
Moreau says there are currently 7 available beds in all of Vermont.
We've made some good progress. We have 2 homes that are hopefully coming on the line soon in Bennington. A new home for women with children has opened in Barrie.
Another issue the recovery residence industry is seeing is pushback from neighborhoods that don't want the homes in their backyard. They meet fierce opposition at zoning board meetings, making it difficult to expand.
It's all this kind of fear stuff. So a lot of the times, once we're there and, you know, they see that they're just normal people doing normal things, a lot of the stuff kind of subsides.
I remember when I was a kid, I used to be terrified of heights.
For Lesko Navarro, starting over in a new place meant the world. He finds joy in going to church, helping to paint the homes of congregants, and helping his community in any way he can.
Maybe, I think I got it. Everyone has their own preferences, but I think it's about who you surround yourself with that makes a difference.
In the 4 years the Rutland House has been open, they've seen about 12 people a year. Gagne says he knows only 4 people who have left the house and continue to achieve their goals. One worry the industry has about expanding access to recovery residences is that the system will be more overloaded than it already is. The Substance Use Addiction Summit is proposing a 3-state model where Maine, New Hampshire, and Vermont would all share patients and beds. In the studio, I'm Laura Ullman, Channel 3 News.